1 in 5 of us are going to deal with a mental illness in a given year. So think about your friends, your neighbors, maybe your breakfast group. One of us is going to be affected at any given time. So what we're really trying to do is to augment services at every level of care, from outpatient to inpatient, knowing that it's a real problem in our community.
Geisinger Behavioral Health Center in Danville is the second of 2 hospitals that will serve patients with mental health conditions and in an acute setting where they get an intensive treatment plan to help them recover and go back to the community to continue their treatment outside of the hospital. This facility is able to have up to 96 beds with the potential to add more. Typically, we have around 10 to 12 admissions every single day.
I kind of feel like this is the fulfillment of what Abigail wanted us to do. She wanted to bring healthcare to our rural communities. And today, pediatric patients that need inpatient stays are going to Philadelphia or Pittsburgh. And so for the first time in central Pennsylvania, we'll be able to offer this care in Danville so that these children can stay in their communities and stay connected to their parents and systems. This is a place you'd be proud to stay yourself or send a family member. It really honors patients when they're in probably the worst crisis of their life.
In terms of emergency room, patients, when they come in, as they get medically cleared and assessed and evaluated, when there is no bed in the area, they tend to stay and board in the emergency room for long hours and sometimes days. So having an easily accessible center around the community will make that time way better so that they can get the much needed treatment and as soon as possible.
Geisinger has made tremendous investments in behavioral health care, not only these inpatient facilities, beautiful facilities, but also in outpatient. We have doubled the number of outpatient providers, both psychiatrists, therapists, to serve our communities. And there is unprecedented demand for our services. So we're really looking to continue to innovate, and this is one step in our journey of adding more access for our communities.
You know, as a psychiatrist who spent my whole career serving underserved communities, seeing the investment that Geisinger has placed in behavioral health and opening services in our areas couldn't be any more rewarding.